My name's Brandilyn Binstock, and I'm a functional medicine and primary care provider here at Vida. One condition I see a lot of is hypermobile EDS or hypermobile spectrum disorder. Now, these patients not only have chronic pain, but they often struggle with other symptoms associated with nervous system dysfunction. This group of patients benefits from personalized medicine. How we start that process generally is by gathering comprehensive lab data. First, we want to figure out, are there any nutritional deficiencies that can be perpetuating their symptoms? Do they have any hormonal imbalances that could be resulting in inability to heal connective tissues? So we start with comprehensive lab analysis, and often we'll do a genetic analysis too. When managing these symptoms and conditions, we often use a combination of therapeutics. Sometimes we tap in pharmaceuticals, we'll often use botanicals or nutraceuticals, and of course, physical medicine can go a long way in pain management. In the last year, I've been working with a female in her 20s who had been struggling with chronic fatigue, difficulty really with standing up and being able to carry out daily tasks, and she virtually has not been able to do any exercise, which is one of her main hobbies. With thinking about her case, the first thing that we did was gather additional lab data. What we found is that she had multiple different nutritional deficiencies that can contribute to or even worsen the symptoms of her connective tissue disease. So we start with replenishing these nutrients so that the body has what it needs and able to function appropriately. Next, we looked at her comprehensive stool analysis. This gives us a lot of information about the gut, which plays a significant role in many other systems. What we found on stool analysis is that she did have a dysbiosis present in her gut, and it was essential to treat that because that can contribute to not only inflammation at the gut lining, but also inflammation systemically, which can perpetuate these nervous system symptoms, her fatigue, and chronic pain. After a year of working together, we've been able to find the right combination of therapeutics to help manage her symptoms, and now she's able to carry out her daily tasks, she's able to play volleyball again, and she has had minimal daily pain. Now with these conditions, because they are genetic, we follow the seasons of life, and when certain things come up, we come back together, we reanalyze her data, and we change out certain therapeutics that are no longer indicated. This is the best approach to continue managing chronic conditions that we are not necessarily resolving because of their genetic nature. The functional medicine concierge model works really well for patients that have hypermobility and chronic pain, along with other nervous system symptoms, including fatigue, because we have more time together, we're able to gather more comprehensive data and change the plan out as needed depending on the season of life we're in. I also tap in our functional nutritional specialist to look at the diet and determine if there's any areas where nutrition may not be adequate. These are all things that are important to not only replenish nutrient status, but maintain that status throughout time. What I love about practicing in a functional medicine concierge model is that I get to spend more time with my patients, understanding their story and individualizing the care that I provide. If this type of care resonates with you, I still do have open spots on my panel, and I'd love to see you here at Vida.